Hey there, I'm Dr. Roger Moczygemba. I'm excited to be here. This is an open house and ribbon cutting of our second location of Direct Med Clinic on the south side of San Antonio. I'm so excited for this because our wonderful model called direct primary care is expanding. We are thriving in our first location, and we're bulging, so we had to open another location, and we're so happy to be on the south side of San Antonio because there's a need. I mean, ever since we opened 5 years ago, we've always had people tell us, hey, when are you going to put a clinic on the south side? So we're finally here. We've been told that people on the south side would love this model. So let me just mention a little bit about the model, because it takes a little bit for people to comprehend it and for it to sink in. Most of the time when people hear about healthcare, they're thinking insurance. And you especially associate that when you hear healthcare talked about on TV or in the media. Well, this is what we do is not insurance, it's healthcare. It starts in the room between the doctor and the patient. So the way our model works is people pay a small monthly membership fee to the clinic, and then anytime they want to see the doctor, they just come in, okay? So people can get in to see the doctor same day or next day. People can text us on the app that we give them, which is HIPAA compliant and secure. So we don't take insurance. Insurance is what makes healthcare very expensive in primary care. And I'm not saying that we don't need insurance, but we don't need insurance for primary care, okay? We don't need insurance for primary care because that makes it very expensive. A lot of people we find these days have a high monthly premium, and then they have a high deductible. So unfortunately then when somebody gets sick, they try to write it out, or oh, I think I'm going to get better, and sometimes they don't. And they end up having to go to the emergency room. Or sometimes they want to get in to see their doctor, but they don't, because they have to pay full price because they haven't met their deductible. I just feel so sorry, when I feel so sad when I hear those kind of stories, because in our model, you pay that monthly membership and you have it doesn't cost you anything to come to the doctor. It doesn't cost you anything to text the doctor. And sometimes we can take care of what you need just by texting, or a phone call, or a video visit. A good example of that was during COVID, when a lot of times people's doctors' offices were closed and they didn't know what to do, or they were exposed to COVID. They didn't know if they needed to go to the hospital or what, or they got COVID, they didn't know what to do. Our patients during the pandemic didn't lose a beat with access because we stayed open for the routine things. And when somebody had a respiratory problem, we handled that over the phone or through a video visit, and then with drive-by testing. But they always had access to us, either on the phone or through texting or a video visit. You might be wondering how it works with this membership thing. Okay, so it's kind of like a gym membership. Each person pays a monthly fee to the clinic, and if you have a family and you want your spouse on there, well, then they pay that same fee. If you have children, then that's a little bit of an extra fee as well. So we do have a lower rate for the children. Our prices are posted on our website, which is directmedclinic.com. And not only that, prices for everything else are posted on our website, because we're big believers in this direct pay model. I'll give you an example of what I'm talking about. Sometimes when somebody has insurance, it usually has a deductible, and then they go and they get labs. Well, it might cost them $200 or $300 to get labs, even though they have insurance. But we pass on the clinic's cost for labs to our patients, plus a small fee to draw the blood. So our fees are way cheaper than even going to get blood draw if you have insurance. For example, it might be $20 or $30 or $40, whereas somebody with insurance will have to pay $200 or $300 for labs. You might be wondering how it works with medication. The way we approach that is we're always looking for the most economical medicines to use with our patients. And we use GoodRx quite a bit. So we're always looking for those options. So sometimes people will use GoodRx. If a member patient of ours has insurance, then when they go get their medicine, they can use their insurance. But if you've been in a situation before, you might know, or maybe you don't, that sometimes it's cheaper to pay for your medicine without using your insurance. So we just try to, look for the best, most economical option when it comes to medications for our patients. Sometimes people need to see a specialist. We are trained in family practice and internal medicine. I'm trained in family practice. Dr. Packard in our practice is trained in internal medicine and wound care. But when we're treating a patient and it looks like we're getting to a point that we're a little bit uncomfortable and thinking we might need the help of a specialist, the practice pays for a service to where we internally, doctor to doctor, can reach out to a specialist electronically and present our case to that doctor, that specialist, and they'll answer us back usually same day or next day. So they will tell us something like, if that patient was in my office, I would do this, 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 and this for them. Or I would run this test and this test. And then we have that, we pay for that internally extra, so we save money for our patients so they don't have to go to a specialist. It doesn't always work that way. Sometimes when we do a consult with the specialist, they might say that, oh, this person needs to come in and get a biopsy. Well, in that case, we will look for a specialist in our network, because doctors, have their own network of specialists and folks that they work with. And so we will find the best specialist for that patient. And if our member patient has insurance, then they can use their insurance there. If they don't, then they can use the cash pay rate, because we have a network of specialists that accept cash, and it's better to pay cash for something if you can, so that's how it works with specialists. I actually am part of an organization that I started here in San Antonio called the Free Market Medical Association, where we pull together patients, employers, primary care doctors, secondary care doctors, specialists, and a couple of hospital systems and surgery centers, and some insurance brokers, to create this free healthcare market in San Antonio. And that's another resource that brings together the whole healthcare continuum to take care of patients in a direct pay, economical way. Because you don't have to use your imagination to know that it just makes sense. If you can pay for something directly without the middleman, then it's cheaper, right? For example, we all have insurance on our car, but we don't use it to change the oil or change the tires, right? Because if we did, it'd be a lot more expensive. To find out a little bit more about what we do, we have a lot of information on our website. All of the prices are on our website. It's directmedclinic.com. You can go there and poke around our website and learn, or feel free to give us a call. One of the things that we decided a long time ago from the very beginning, we want to be able to answer the phone when people call, because a lot of times we get annoyed when we're trying to call somebody and we get a recording, or we have to leave a message. We strive to answer the phone. So if you wanna call us, we'll hopefully be able to answer. We won't be too busy. That's another thing I would love to mention is that when you come see a doctor in our model, it's not rushed. You know, we take time with our patients so we can listen to you and talk to you. We want to get to know you. We want you to know that you can reach us when you get sick. One last thing that I would like to say to the community is, besides the fact that I'm excited to be here on the South Side offering the direct primary care model, is I just want people to know that it's affordable for us to take care of people with high blood pressure and diabetes and cholesterol and thyroid, all of those things that you would get in a family practice office. We offer that very affordably. I just want people to know that they have access to us, to a doctor, and it's affordable if they need that.